Hi, this video is the demonstration of the FUE donor scar, more than a year follow-up, and the scar result vary from one individual. But the great thing about FUE is that it leaves tiny dots of scar, allow you to wear your hair shorter. Unlike the strip method, it will leave you a permanent linear scar for the rest of your life. So there's always pro and con for both, and I do both FUE and FUT. The benefit of FUE are, number one, less visible scar. Number two, we don't cut you open, so that means less invasive, less side effect, less painful during recovery, less chance of infection, faster healing than the strip method. The downside of FUE are it's more expensive than the strip method because the labor, you're going to cost more. And number two is the number of grafts we can do is less. We can do 2,500 to 3,000 grafts per day. Although there are days I can go beyond 3,000. The number three is the growth rate. Now you can have excellent growth result, hair transplant result, with whether you're done by FUE or FUT by me. I'm a specialist for both. However, the FUE growth rate is slightly less than the strip method. It's 5 to 10% less. Again, you still have fantastic result with both. On the other hand, the FUT will leave you a linear scar and it's permanent for the rest of your life. The FUT had to cut you open. That means you're going to have a suture, and the suture need to be removed. It's more painful, more bleeding, more chance of infection. It's a little bit more invasive. Again, both FUE and FUT are minimally invasive. That's why we do outpatient, and you go home. The downside, those are the downside of FUT. But the benefit of FUT is cheaper than the FUE, and the number of grafts we can do is more. We can harvest 45 to 6,000 grafts per day, depending on what kind of density and how elastic and loose your scalp is. In terms of growth rate, you can have very good result with both FUE and FUT, because I perform both and I'm a specialist for both. However, the FUT will grow 5 to 10% better density than the FUE. The FUT can harvest more graft. That means it's more for advanced hair loss. Although you can do the FUT for smaller hair loss too, but most people nowadays they do FUT only for advanced hair loss, where the FUE is more preferable with the mild to moderate hair loss. And again, you can still do a FUE on advanced hair loss. You're just going to need multiple surgery. So this is the demonstration of the FUE donor scar shaved completely without a gar. More than a year follow-up. Thank you.